Hi everyone, welcome back to my channel. Myself Lakshmi Vishwan, the trainee social worker of Sri Shavarisha College, Kottayam, Kerala. This video is explaining about the role and functions of psychiatric social worker in different settings. Move on to the topic. Who is a psychiatric social worker? So, psychiatric social worker is a mental health professional who provides assessment, diagnosis, and treatment to individuals, families, and groups. They work with patients to identify and address emotional, behavior, and psychological challenges. So, their goal is to empower clients to cope with mental health issues, improve their well being, and enhance their quality of life. So, the different types of settings are first one is psychiatric outpatient department in the government general hospitals. So, a psychiatric outpatient department or OPD in a government general hospital provides work in the consultation services for individuals with mental health concerns. Patients can receive assessment, diagnosis, and treatment from a psychiatrist or other mental health professionals without requiring hospital admission. The OPD offers an accessible and affordable entry point for individuals seeking mental health care. Next one is the role of psychiatric social worker in psychiatric OPD department. Here are the main important roles of a psychiatric outpatient department in a government general hospital. First one is a counselor. So, a counselor provides guidance and support to patients and their families to cope with mental health concerns. Next one is mediator. Mediator facilitates communication and conflict resolution between patients, families, and healthcare providers. And the third one is advocate. Advocate, he supports and empowers patients to express their needs and rights and ensures they receive appropriate care. And the fourth one is educator. So, educator provides information and education to patients, their families, and communities about mental health, illness, and treatment options and plans. And the fifth one is referral agents. So, they connect patients with community resources, support services, and specialized care and needed. And the sixth one is the supporter. So, he or she offers emotional support and engagement to patients and their families throughout the treatment process. And the last role of psychiatric social worker in OPD department is liaison. So, liaison coordinates care and services with other healthcare providers, community agencies, and social services to ensure comprehensive care. And the next one is the functions of psychiatric social worker in OPD department in government general hospitals. So there are seven functions of psychiatric social worker. First one is registration and assessment. The process of registering patients and conducting clinical assessments to gather information about their mental health concerns, medical history, and personal circumstances are added. And the second one is diagnosis and treatment. The process of evaluating patients' symptoms and their behaviors and medical histories to diagnose mental health disorders and developing treatment plans to address their specific needs. And the third one is medication management. So, the process of prescribing, monitoring, and adjusting medications to treat mental health disorders, minimize side effects, and ensure the optimal treatment outcomes. And the fourth one is counseling and psychotherapy. The process of providing a talk-based therapies to help patients understand and manage their mental health concerns and developing coping strategies and improve their overall well-being. And the fifth one is case management. The process of providing talk-based therapies to help patients understand and manage their circumstances. It is a process of coordinating care and services for patients with complex mental health needs, including linking them with community resources, supporting their social and occupational functioning, and advocating on their behalf. And the sixth one is follow-up care. It is the last stage of the case study or the group work. The process of scheduling regular appointments to monitor patients' progress, adjust treatment plans as needed, and present relapse or hospitalization. And the seventh one is the emergency intervention. So, the emergency intervention is the process of providing intermediate assessment and treatment for patients in crisis, including those experiencing suicidal thoughts, psychiatric episodes, and or other acute mental emergencies. So, the acute mental health. So, the next setting is day hospitals. So, a day hospital is also known as a partial hospitalization program, provides intensive structured treatment for individuals with mental health conditions. So, in this type of settings, the patients attend the hospital for several hours a day, typically 5 to 7 days a week, and return home in the evening. This setting offers a supportive environment and therapy services over the sessions while allowing patients to maintain some independence and daily routines. Next one is the role of psychiatrist social worker in the day hospital setting. So the counselor, mediator, advocate, educator is also explained before. The therapist. So therapist uses an evidence-based therapy such as cognitive behavioral therapy or CBT to help individuals or groups or families manage mental health symptoms, behavior and relationships. And the case manager. Sixth one is case manager. So he coordinates care, services and resources for individuals, family or groups, ensuring they receive comprehensive and continuous support. And support and liaison is also explained. And the ninth one is group facilitator. He leads and facilitating group therapy sessions and therapy sessions, supporting groups or educational workshops, promoting socialization, skill building and community engagement. And the last one is crisis intervention, the role of psychiatric social work in day hospitals. That is the crisis intervention is providing the immediate support, assessment and intervention during mental health crisis, such as suicidal thoughts, psychotic episodes and traumatic events. So the next one is functions of psychiatric social worker in day hospitals. In this, the assessment and diagnosis, treatment plan, and counseling and therapy, case management, crisis intervention, family support and education is also described. And the eighth one is group work. Seventh one is group work. So group work is explained about it leads and facilitates group therapy sessions, support groups or educational workshops, promoting socialization, skill building and community engagement. And discharge planning. Discharge planning explains to develops and implements discharge plans, ensuring patients have access to necessary resources, services, and support after leaving the day hospital. So the ninth one is collaboration and consultation. The collaboration with interdisciplinary teams and another social teams, healthcare providers and community agencies to ensure comprehensive care and coordination. And the 10th one is documentation and record keeping. It's a important function for psychiatric social workers. It maintains the accurate and up-to-date records documenting patients' progress, treatment plans and outcomes. So the third setting is child guidance clinics. There are many child guidance clinics in the country. So the child guidance clinics provide comprehensive assessment, diagnosis and treatment for children and adolescents with emotional, behavioral and psychological difficulties. So a multidisciplinary team of professionals including psychiatrists, psychologists and social workers work together to address the unique needs of each child and their family. The clinics offer a supportive environment for children to receive therapy, counseling and guidance to promote healthy development and well-being. So, the roles of psychiatric social workers in child guidance clinics is also explained in the OPD department and the day hospital settings. So, I repeatedly announced that first one is advocate, mediator, counseling, therapist, case manager, supporter, liaison, educator, family therapist, and lastly the crisis interventionist. So the next one is functions of psychiatric social workers in child guidance clinics. So the first one is assessment and diagnosis, treatment and planning, counseling and therapy, family therapy, case management, group work, crisis intervention. And the eighth one is parent guidance. So it will be explained by me. It educates and supports parents and caregivers on parenting skills, child development, and strategies to promote healthy mental health and behaviors and their public health concerns. And the collaboration and consultation, last the documentation and record keeping is also explained in the previous slides. And the fourth and last setting is epilepsy clinics. So epilepsy clinics provide specialized care and treatment for individuals with epilepsy, a neurological disorder characterized by recurrent seizures. So, a multidisciplinary team of healthcare professionals, including neurologists, nurses, and social workers, work together to diagnose, treat, and manage the epilepsy seizures or epilepsy to enhance the offer and comprehensive services, including medication management, seizures monitoring, and lifestyle counseling. And the next is role of psychiatric social work in epilepsy clinics. The counselor, educator, advocate, case manager, supporter, liaison, family therapist, group facilitator, crisis interventionist is also explained in the previous slides. So the last one is the researcher. It's the main progressive role of psychiatric social worker in epilepsy clinics. The researcher, so the participants in research studies. And the researcher is a participant mainly in research studies, collect data and analysis outcomes to improve understanding of epilepsy and seizures, its treatment, and the effectiveness of social work interventions. And the last one is functions of psychiatric social worker in epilepsy clinics. So assessment and diagnosis, treatment planning, counseling therapy, management or case management, family support and education, group work. Crisis intervention, advocacy and liaison, research and evaluation. And the last one is documentation and record keeping is also explained in the main settings. So the functions of these four settings are same, and the role will be sometimes different based on the situations and the patient, client, or the social workers relationship between them. So these are the roles and functions of psychiatric social work in different settings, like psychiatric outpatient department in government general hospitals, day hospitals, child guidance clinics, epilepsy clinics. So that's it. So thank you for watching my video. Thank you.